So you want to know if prostate cancer surgery is reliable at removing the cancer. Well, in this video, you're going to learn all about prostate cancer surgery and whether or not it's reliable at completely removing the cancer. Welcome to Health Drum. I'm Dr. Bert Vorstman, a urological surgeon and former researcher, and this channel is all about routine medical conditions, self-care, and digital health so you can be informed and in control of your healthcare needs. If this is your first time on the channel and you like to get fact-based healthcare tips, go ahead and subscribe below. By the way, Health Drum is for educational and informational purposes only and not a substitute for professional medical advice. The links to the disclaimer and the material in this video are in the description below. So prostate cancer marketing is full of scare tactics and urgency. But is this material trustworthy? So here are some stats that are commonly marketed. That 1 in 8 men will be diagnosed with cancer. It's the most common cancer diagnosed in men, and it's the second most common cancer causing deaths after lung cancer. And that some 30,000 or so men will die from prostate cancer annually in the US, and that early detection may lead to survival. What these statistics don't tell you is that not all prostate cancers are equal, and that most prostate cancers are outlived. In fact, most everything in the prostate cancer arena is an exaggeration. So let's start sorting fact from fiction in the prostate cancer arena. So let's get into a little background about prostate cancer recommendations. Remember, healthcare is financially driven and full of financial conflicts of interest. Healthcare is plagued with claims, exaggerations, and misinformations. As well, most published research is false, and only 11% or so of medical treatments are of known benefit. And despite most treatments being unproven, many are still FDA approved, included in medical guidelines, and labeled as standard of care. Let's check some of the many claims marketed about the benefits of prostate cancer surgery. You will read and hear about many of these so-called benefits concerning both open and robotic prostate cancer surgery. That it's best cut out, it's no more than a keyhole procedure, you get it over and done with, it's potentially curative, and there's only a small chance of complications, etc., etc. None of that is true. Surgery is associated with many potential complications and fails to extend life. Again, the links to these facts about prostate cancer surgery are in the description below. So how did prostate cancer surgery enter the treatment landscape and become so-called standard of care? Dr. Young from Johns Hopkins published his results about prostate cancer surgery in 1904. He claimed early diagnosis, radical cure, and that it was simple and effective and with great results. However, in the body of the report concerning 4 patients, you discover a barefaced lie. 2 patients died and 2 were left with lifelong urinary leakage after prolonged hospitalizations. Clearly, his conclusions about prostate cancer surgery were in stark contrast with the actual miserable results of this surgery. So radical prostate cancer surgery became standard of care without any scientific supporting data for safety or benefits. So how did robotic prostatectomy become standard of care? The robotic device entered the surgical treatment landscape in the 1980s and was tested in Mexico on a few patients needing gallbladder surgery. Although there was no evidence of real benefits, the robotic device was still FDA approved for gallbladder surgery. However, the device makers quickly realized that there was no market for robotic gallbladder surgery as the laparoscopic approach was easier. Eventually, urologists were found and approached, and they were keen to try the device for robotic prostatectomy as they still believed in cutting it out. However, instead of scientifically testing the device for safety and benefits for robotic prostatectomy, the device was simply rubber-stamped approved through the misguided FDA 510(k) process. So neither open or robotic prostate cancer surgery were ever supported by scientific evidence for safety and benefits. Are these procedures associated with any complications? Both open and robotic prostate cancer surgery are associated with many potential complications, from general complications such as hemorrhaging, deep vein thromboses, and pulmonary emboli, to damage to adjacent organs such as nerves and rectal tears, to a high incidence of residual cancer, erectile dysfunction and other penile complications, urinary incontinence and other bladder and urethral complications, and so on. So both open and robotic prostate cancer surgeries are associated with many complications. What about their life-saving ability? Do these procedures save significant numbers of lives? So let's take a good hard look at this screenshot. Does prostate cancer surgery save significant numbers of lives? In fact, urologists' own studies showed that at 12 years, surgery failed to save significant numbers of lives. Then another study taken out to 15 years showed that those that had had no treatment had similar survival rates to those that had had surgery or radiation. Again, all the references to this material are in the description below. So not only are the claims about the many benefits of prostate cancer surgery absolutely wrong, the procedures are associated with numerous potential and debilitating complications, and these procedures fail to save significant numbers of lives. Are they even good cancer operations? So not only is prostate cancer surgery filled with potential complications and fails to save significant numbers of lives, but it's totally ineffective at removing all of the cancer. In fact, residual cancer or a positive margin is found in 11 to 48% of patients. As well, a biochemical recurrence due to residual prostate cancer cells producing PSA is found in 20 to 40% of patients within 10 years. This means that prostate cancer surgery is not a good cancer operation. Clearly, you can have residual cancer or a positive margin because the disease was more extensive than the surgeon predicted, or the surgeon failed to take enough of the prostate. But how do you explain a biochemical recurrence or a rising PSA when it appeared that the whole prostate had been taken? So how do you explain total removal of the prostate and clear margins or edges, but then the PSA starts climbing sometime after surgery? This is called a biochemical recurrence, and clearly it's because cells had already spread from the prostate. Now, whether this was during manipulation of the prostate gland during surgery to remove it, or whether this had already happened before surgery is unclear. It is known, however, that in some high-grade prostate cancers, cells have already spread to the bone marrow before the tumor is barely detectable within the prostate. These metastatic cells can lie dormant in the bone marrow for years before some of them activate and spread to other organs. So how do physicians manage positive margins or residual cancer after radical prostate cancer surgery, or a rising PSA or so-called biochemical recurrence sometime after radical prostate cancer surgery? So how do physicians treat the 11 to 48% of patients who had a radical prostatectomy but still have positive margins? These patients are commonly treated with postoperative radiation. This is surprising because studies have shown that radiation for prostate cancer also fails to save significant numbers of lives. On the other hand, a rising PSA or biochemical recurrence, which is found in about 20 to 40% of patients within 10 years of treatment, are commonly monitored until their PSA is significant, at which time they are usually managed with testosterone suppression. So let's recap. In this video, is prostate cancer surgery reliable at removing cancer? You learned that prostate cancer surgery is associated with numerous potential complications, it fails to save significant numbers of lives, and it's not even a good cancer operation. To learn more about routine medical conditions, self-care, and digital health, check out these other videos.